Welcome to the Caregiver Relief Podcast. I'm Diane Carbo, RN. Today's conversation is one caregivers will recognize immediately because it's about the medication list that keeps growing even when things don't seem to be getting better. I'm joined today by Dr. Donna Bartlett, a board-certified geriatric pharmacist who also happens to be a family caregiver to her parents for more than 2 decades. Donna understands the caregiver role firsthand, the responsibility, the advocacy, and the concern that over-medication often becomes unavoidable for older adults. In this episode, we're talking about polypharmacy, de-prescribing as a legitimate treatment option, and how caregivers can help reduce harm while improving quality of life. This is a conversation rooted in experience, compassion, and practical guidance for real families. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Donna, as someone who has been both a clinician and a caregiver for your parents, when did you first realize how easily over-medication can become part of the aging journey?
I think it was even before I became a caregiver when I was dispensing and spending much of my time trying to share information with people who would come into the pharmacy, and I would fill bags and bags of medications, and I just had in my head, this just isn't quite right. And then people would come in and ask questions for their loved ones, and I would start to make suggestions. I think it could be your medications or their medications, and start talking with them a little bit about it. I still get a lot of barriers, if you will. Oh no, it can't be
Yes.
those types of things. But
Yes.
yeah, I have to say that's when it started, when it really hit me. And I'm just filling prescription after prescription for the same person. And I started just questioning.
I used to do agency nursing to keep my fingers in nursing, and I went to my first nursing home that I went to. I was totally shocked. Patients were taking 20, 30, 40 pills a day, and I was like, "Oh my lord, why is this allowed to happen?" So, how did your own caregiving experience shape the way you view medication use in older adults?
Yeah, so I'll give you some like great examples of just what happens day to day. For example, there was a time when my dad, his blood pressure was going too low. So they were reducing some of his blood pressure medications.
Mhm.
And when they reduced one of them, which was a diuretic, they never took off the potassium that was needed
Yes.
in order to keep the potassium levels normal while he's on this diuretic. And I'm always trying to help my parents, and so I knew that he had gone off of that medication, and I used to fill their prescriptions for them when I was behind the bench. So he calls in a prescription one day for the potassium, and I'm like, "Dad, you don't need that anymore." And so I ended up having to call the doctor and saying, "I don't think that this medication's necessary any longer because the diuretic is not being used any longer." And sure enough, it was like, "Oh yeah, of course, he doesn't need that." And it bothered me though,
Yeah.
because I was just like, well, the potassium could have gone too high. And we know that can bring somebody to the
Yes.
emergency department too if
Oh,
their potassium levels are too high. So that was like one quick little thing. And then even years later, just working with my mom and her medications and some of her comorbidities. It was when I started to be invited to the doctor appointments, if you will, when it
Yes.
comes to that time when you are there helping out your parents. And I would question a lot. And having the background, I would pressure them as to why she's still on this. Is this still necessary? I will work with you to see if we can reduce this. What do you want me to look for? I'm trying to have that communication, and I'm happy to send you messages if I will check to make certain she's doing fine. What are your concerns? And that really helped with really changing how doctors worked with my mom and in being able to reduce unnecessary and inappropriate medications.
I encourage my seniors and my family caregivers to review the medications that you take, your medication list with your primary care physician every 6 months to a year. Because the problem with our society or medical delivery system right now, you have a specialist for everything. So they give medications and it doesn't always get back to your PCP what you're taking. So I think it's really important that number one, keep an up to date medication list with you at all times. And if you make changes, note them and notify your PCP because your primary care physician, because it gets scary out there.
Yeah, it does. But with that, I also have to say that, and I hear this all the time from folks, is they think they're having a med review done
Yeah.
when they're at their doctor's office, but
Yeah.
they're really having a med reconciliation done. And it's, are
Yep.
you taking this, and do our records match what do we think we're taking, what you are taking? And having that medication reconciliation is one thing that is important.
Yes.
But to really do a true medication review, it takes
Mhm.
a long time. It's not just this quick check of
Correct.
meds. It is going in depth and diving deep into these medications, how the patient is doing, and what are the things that the patient is actually grabbing that they might not be talking about. What are they self-prescribing? And
Exactly.
so those are things too that really take time. And I think it's really important to really have a team of folks to speak with. So every provider, but also your pharmacist, also if you're talking to a nurse or a PA or a nutritionist, all of these folks, they can
Yeah.
maybe help guide you.
That's another problem because so many people are on mail order pharmacy and because I know for me, I do mail order for some through my insurance, but I go to Walmart to get cheaper meds that are cheaper than what Medicaid or Medicare will pay. And now I have two pharmacists, and that's always an issue. And I'm familiar. I always go over my medications, say, what could we get rid of? What can I decrease? And I'm really stay on top of it. But why does over medication feel so inevitable for seniors and their caregivers?
Yeah. So what happens is we're really in a world where we prescribe. We've been doing this for years and years.
Yes.
And
Yeah.
so what is met with a problem, there's tends to be a prescription for it. What I like to say is, let's take a step back, and could it be a medication that's causing whatever is happening so that we don't end up adding on more and more medications? So I do medication reviews for individuals, and there's oftentimes when one medication will lead to a number of more medications just because of side
Yes.
effects, one thing to the other. And I always give an example of one medication leading to five medications. And we can see this very simply with medicines that could increase the risk of edema or swelling in the ankles, for example. And then a diuretic is being added on. And then after that, something for incontinence is being added on.
Yep.
And then after that, there's something for constipation because
Yeah.
all of these have now
Yep.
had their side effects. So we just keep continuing to add on more and more meds. So that's just like one small example, but this happens quite often. So when you're looking at an issue that you have, a true like health condition that you have, I think it's really important to say, how many meds am I on for this one condition? So, say for example, it's blood pressure. We do know that people do need maybe more than one blood pressure medication in order
Mm.
to treat their blood pressure, but is it more than 2 or 3? Do you have 5 different meds that are now you're using for blood pressure? What about depression? Are you just using one thing or are you using 3 different things? There's so many times that we just keep adding on, even if we're not responding well to something, and then more is added on, but nothing's really ever taken off. So I think that's when we get into trouble.
I think one of the most dangerous times is when you're being discharged from the hospital because they give you, here's your list of medications, and you go home with all these pills, and it's not the same ones you were taking before. And then there's this big confusion. And some seniors don't think about it and they just take everything. And it's really dangerous. And that's why I encourage my seniors and my family caregivers to take the before they went into the hospital list with you. Make sure you have the whole thing, and then go back and forth to see and ask the doctor or the nurse so that they can find out from the doctor what you should be taking and which ones you should be discontinuing. They don't take time to do that in the hospital anymore, and I think that's very frustrating.
Yes. So I actually have a site where I teach pharmacy students at a hospital and
Mhm.
we do transitions of care. So we're looking at what patients are coming in on and seeing what their issues are and why did you fall or why is your
Yeah.
sodium low or what happened? Why did you have this exacerbation of your heart failure? It could be other meds that are causing these
Yes.
issues.
Yes.
And then seeing what's going on, we're making recommendations to the hospitalists, and then once they leave, checking on that to make certain that it makes sense. So it's really important. Any of those transitions of care is
Mhm.
very important. But I also want to say that even when a medication is being added on by a provider, so even if
Mhm.
it's a specialist or a PCP, I think it's really important to understand at that point too, is this something new that I'm adding on? Is this replacing something? How long should I be trying this for to see if it's even working? After I get started on this, is something else going to go away? So you can be asking those questions. I do, again, just because it's what I do, but pharmacists are really important to have in these conversations too.
Absolutely. Yes. Oh, I'm 100% behind that. So can how do multiple medications increase risk for falls, confusion, or even total loss of independence?
Yeah. So there are various studies out there that the increased number of medications can increase the number of falls and it can increase the risk of frailty. And frailty is how we might be able to move or not move around or take care of ourselves.
Yeah.
So when we're looking at medications, there are some different things that we know. So, depending upon the number of medications, 5 or more medications, whether it's prescription or non prescription, is considered polypharmacy. So, if you're taking 5 or more medications, you're already at risk of having some adverse drug event or having something occur because of medicines. Each medication that we add on to someone's profile, we add on a 7 to 10% risk of more adverse events. So by the time you get to 10 medications, you're close to 100% of there being some issue within those medications, whether it be a drug interaction or some type of side effect that could be occurring for you, maybe an additive side effect. So when we're taking multiple medications, we could be having additive side effects. In some products that we're very concerned about, things that are we find in medications for depression or anxiety, medications that help us sleep, medications that help with allergies, for example, or muscle relaxants. These medications have something called an anticholinergic burden. And basically, what that means is it dries you out. So, if you have dry eyes, dry mouth, If you're constipated, for example, those same types of medications can also increase your risk of falls and can increase your heart rate too. So there's a lot of things going on in your body there, and they cause confusion as well. So we often, in the groups that I work with, we're also looking at this anticholinergic burden. So the number of meds, anticholinergic burden, and how well is this person? What is their frailty score? And once we look at those, we try to drive those numbers down. Because if we drive those numbers down, people will be able to be healthier and stronger and be able to go about their life without having to fall and have all of these other side effects. So those are three things that we concentrate on. But there's a lot of studies out there that do show that if you reduce medications, you will reduce some of these risks. What I like to say is when we're reducing medicines, not to think about, oh my gosh, they're stopping treatment. We're often treating an issue by stopping a medication.
Yes.
So we're relooking at things and saying, oh, this could be causing this. I don't think you need this anymore, or let's switch it to a safer alternative for you. And
Yeah.
then we're able to help the patient.
One point I wanna bring up is people don't understand that the supplements they take or the herbal teas that they drink all can play a part in having an interaction with their medication. So those things as well should be included in their medication list. I know people don't believe that, but truly, just because they're all natural does not make them safe.
Correct. And people will say to me, when I ask them about their medications, they'll say, oh, I don't take a lot of medications, but I take a lot of natural products instead.
Uh-huh.
I always say everything counts and it matters.
Yes.
That could be problematic too. And I try to make certain, I even said a little bit earlier that everything counts. So prescription and non-prescription. So anything you're getting written by a provider for prescription wise, or anything you're grabbing over the counter, whether it's an over the counter med, an herbal, some
Yeah.
type of supplement, it all counts. The other thing I'd like to bring to people's attention is people will have some supplements or herbals that are combined. So they might have something, let's say for digestion, for example, and there'll be many different products within that digestive pill, if you will. And so with that, those number of supplements can really add up. So I worked with people who have taken a few different supplements or maybe 5 different supplements, but they're actually taking 30 or more supplements because there's so many things packed in those various supplements that they're taking. So be aware as to what you're taking and really think about how many products you are truly taking.
That's interesting because I didn't know that about the different supplements. I didn't think about it. Now, seniors and caregivers fear changing medications. You've said that. What does de-prescribing actually involve?
Great question. Thank you for asking it. So de-prescribing is really optimizing your medicines, and it's really making certain that the medications that you are taking is only what you need. So de-prescribing can be a reduction in a dose of something that you're taking. It could be switching to a safer alternative if treatment is still necessary, or it could be stopping a medication that you really don't need any longer or isn't safe for you for whatever reason. You're having some type of adverse drug event because of a particular medication. So, a lot of medications do need to be tapered off slowly too. And you tend to do this on a step by step process. So, you're not going to take, say, somebody has 15 medications. It's been a process for them to now be on 15 medications. It didn't happen all of a sudden one day, so many years ago, poof, you started on 15 medications all at once.
Right.
It's been a process. Thinking about de-prescribing should not be scary. It is literally the exact opposite of prescribing. It still has to be individualized. You still have to follow the patient. You need to monitor and follow up with the patient and make certain that things are good. Maybe the patient needs to be checking on some things while they're making some small changes. Maybe they have to check on their mood. Maybe they have to check their blood pressure. Maybe they need to check their weight or something. Like, it could be various things. Maybe you have to go for some lab work to make certain that things are in a status quo, that you're still healthy and well and or getting better. The other thing I like to make certain that folks know is if you're stopping a medication that you don't really need, you might not feel anything. You might not feel any different, and that's okay. Like, you don't always have to feel better for a good outcome. As long as you're not feeling
Yeah.
worse,
Yes.
then feeling no different could still be okay. You don't need that
Yeah.
medicine any longer. So that can be a great outcome too. And then the other fear that people have is, oh my gosh, they're going to stop this medicine. Okay. And we're going to evaluate. And if you need it, guess what? We're going to put it back on. So, what's the difference if you prescribe something and start taking something and you have a side effect
Yes.
versus if you stop taking something and you have some odd effect that you need the medicine? What's the difference? Right.
Exactly.
So, you can always go back on it if you need it. So, it is a process. And sometimes people do need to go back on a medication.
Yeah. I'm going to bring up the point that when you should only start a new medication one at a time. So if the doctor gives you like 2 or 3 new meds, you need to introduce them to your body and your system slowly because if you'll know which one you'll have a reaction with.
And yes, but there are some scenarios where in my mind I'm going, nope.
Okay, you know what? You're the pharmacist. I'm just the
Yeah.
nurse.
Yeah, no, not just the nurse. You're very important too. So now I'm just thinking if you've had some type of emergent type of issue that has gone on. So, say, for example, someone has had a heart attack, you are going to be on more than just one medication at that point in time.
Absolutely. Absolutely.
So, there are some scenarios where you are going to be on more than one. But in general, yes, I 100% agree with you that you would go up on one, see how you do, or take one and see how you do. You certainly don't want to uh, just be taking so many things for one issue if you
Yeah,
can help that.
exactly. Yeah. How can caregivers start a conversation with their doctor or pharmacist where they don't feel as if they're challenging authority?
Yeah. So
I don't have a problem with that,
yeah.
but
And I do get that question a lot. And I think it's understanding that this is going to take time, in that again, it takes some research in order for someone to really take a deep dive at the medications. So I think a great way to approach it is to either call an office or call the pharmacy or stop by and just say, you know what, we've been really concerned about all the medicines that mom is taking. We'd really love to have just an appointment just to review all the meds. Do you think you could fit that in for us and make the appointment for that purpose? I do have folks that I do medication reviews for, and they might tell their provider that they are going to see me and that they're reviewing their meds with me. I write something up and they're able to have that conversation. This is what some of the recommendations were. What do you think? So that it's not, this has been a concern when we talked to Donna, this is what she had suggested, kind of thing. Not everyone's going to agree, and every recommendation I make is not going to be agreeable. I think it can be thought thoughtfully entertained, if you will, and maybe within the process. Maybe that's not the first thing that should change, but maybe something else could change a little bit. So it gets the conversation going. And that's what I think is really important, is that this becomes part of the conversation for every visit. That,
Ex-
oh, should I still be taking this med? Is this still an appropriate dose for me? And that's okay. It doesn't have to be a full on every single medicine every single time, but I think it's important to keep the conversation going. I also think that when caregivers are approaching providers or even their own parent, because some I've heard this too. I'm
yeah,
ready. I know my
yeah,
mom or dad needs to make this change, but they're not ready. They're going, "What are you
Right.
talking about?" And I always say, "Take the proactive approach. You've been so proactive all this time. You've taken these meds to help you. Our bodies change. And because
Yes.
our bodies change, we need to make changes too." I was just talking to a doctor recently, and a lot of people are of this thought process that, "Oh, if you've been taking this med for, so many years, it can't be that med." And then I had to say, no, that isn't the case. Our bodies aren't static. What we
Yeah.
eat is probably changed. Our weight, the amount of fluid we have in our system, the amount of muscle and fat that we have changes, whether it's better or worse, those changes happen. And so our whole metabolism and elimination can change too throughout the years. And even what we're taking 10 years ago for medicines has probably changed. So there's so many changes that, yes, it could very well be a medication you've been taking for quite some time that is causing havoc now.
I've seen that before too, and people are always so shocked because, "Oh, it can't be," and I know that you go through that. I'm sure that's challenging. Now, I wanna ask because I didn't know this r your geriatric pharmacist role ever existed. I've been a nurse for 54 years, and I think the time's moving on, and I'm missing some things. Can you tell us what about your role and how it impacts others?
Sure. I'm a board certified geriatric pharmacist, and in pharmacy, there are many different specialties that are board specialized, if you will. So we take a certain exam and we pass for certain areas of expertise. So what does that mean for me? I did this years ago. I became specialized in geriatrics because I did see that, oh, we're going to be an aging population, that there are going to be more older adults than there are younger folk. And I was thinking about baby boomers and the changes that they've made throughout their lifetime for other generations. And so thinking about that, I just felt that this was an important role for me to take. So with that said, I'm a professor at Mass College of Pharmacy and Health Sciences. So I do specialize in geriatrics there, and I have a geriatric concentration. So I'm teaching pharmacy students very specifics on de-prescribing and geriatrics and the how the body changes, basically. So I take students through that. For me as an individual, other things that happened is writing a book, Med Strong, and doing a workbook so that I could really take the information I've been providing people for years and years and put that into a format that they can relate to. And maybe, hopefully, what they get from this is, wow, I should rethink these medicines. Do I still need all this? Is this appropriate? I need to have these better conversations. When you're hospitalized, you should be asking, could medicine I've been taking cause me to get here? What happened? So I really try to use my background in geriatrics in order to educate people. I do a lot of programs where I speak for either it be seniors themselves or providers, so physicians, nurses, social workers who specialize in geriatrics. I do one-to-one counseling as well for people. So I also have a podcast called The Med List, which tries to help people understand that there's a lot of different things that can really affect our med list, good, bad, or indifferent. So thinking about those things. So I really feel that being specialized in geriatrics has allowed me to do so many different roles.
It's necessary now, what you're doing, because Medicare only pays 15 minutes for a visit, pays for a 15-minute visit, and in that time, the doctor's gotta look at the patient, I assess them, determine what it may be, provide a plan of care or treatment, and then document it and go on to the next person. So you have a role that is so important, and I'll make sure that we have links to you on our page because people should be contacting you.
They do.
Yeah. Now, are there certain medication categories that frequently raise red flags in older adults?
Absolutely. And I will go through them, but the one
Mhm.
thing I do want to say is any medication could be an issue for somebody. So even though we list like certain high rollers, if you will, it depending upon you and your body and what you're taking, it really
Yeah,
could be any medication that might become inappropriate. But the ones that are really important to be thinking about, especially when we're trying to reduce the risk of falls, because
yeah,
medications are very much related to increased risk of falls. Benzodiazepines, which are used for anxiety or sleep, so those are things like lorazepam, for example, diazepam, people might know them as antidepressants, and they can cause a lot of issues, unfortunately. But again, I don't want people to not take their meds, but we just want
yeah,
you on the lowest possible dose so that you can get the relief that you need, but
yeah.
still remain safe. There are some antidepressants that we have to be really careful of the amount an older adult takes so that they remain safe. So sometimes dosing changes when people age, so don't be nervous about that. The other things like I said, things to help you sleep. So over the counter PM medications that have the diphenhydramine in it, so that's a antihistamine also used to help people sleep. That causes a lot of issues for people. Any other type of like antihistamine, typically the older ones, so ones that are found in cough and cold medications, tend to be quite problematic for folks. Other things, believe it or not, and I think people are often surprised, but proton pump inhibitors, what people use for GERD or
Yeah.
that acid reflux, if they use them long term, so for a year or more, they start to reduce the absorption of good, important nutrients. So, because of that, people might not be getting the calcium and the vitamin D or B12 or iron that needs a good acidic environment in order to be absorbed well. So, that can be problematic as well and cause people to become a little bit more weak, if you will. Other things like anticonvulsants are also problematic, antipsychotics. Some products that one thing to be careful of is products that are used for urinary incontinence too. So a lot of different products, muscle relaxants, these are things that really can cause a lot of problems for folks.
I've always recommended to follow the Beers criteria. Does that still
Absolutely.
stay
Yes.
today?
Yep. So beer's criteria, there's STOP, STOPP. And then the CDC has a wonderful program called STEADY, STEADI, and that's stopping elderly accidents, deaths, and injury. And it's all about falls prevention. It goes through medications as well.
Awesome. So, how does de-prescribing support quality of life, not just medication reduction?
Yeah. So when people are on fewer meds, they tend to have fewer side effects,
Yeah.
fewer adverse events. They feel better. They have less to try to keep straight, if you will, as to what time they're taking what med. So that's pretty nice. They also spend less money on medications because of it. So they become clearer minded. And it really is quite wonderful when you can see how well someone can feel on less medications. So you might often hear people say, oh, somebody went on hospice and they took off all the meds and oh my gosh, they were like a new person.
Yeah.
And we hear this, but I want people to take a step back or several steps back. Why are we waiting until then? Why are we over medicating? Because if you think
Yeah.
about the folks that have fewer medications in front of them,
Yeah.
they're out doing things, they're out being active, they're doing well. The pictures that you see of people with all of these medications, where are they? Like you said, they're in the hospital, right?
Yep.
They're in long-term care, they're in assisted living. Let's pull that back. Let's make certain that you take only what you need. And we often do need medications at some point in times in our lifetime. But does the problem still exist? Have we made changes? Has our body changed? We can make adjustments as we go. And I also like to bring to people's attention that if you look at a newborn and a 20-year-old, that's the pediatric age, right?
Yeah.
You're not going to give the same medicine to that newborn as you would a 20-year-old. So
Correct.
Now let's fast forward. Someone's 60, 65, they start on some medicine, and now they're 85. Should they still be on that medicine? Are they 95? Should they still be on that medicine? The that's our body changes, and we need to consider how long we've been on medicines.
I worked on a senior behavioral health unit, and a neuropsychiatrist that ran the unit put when patients first came in, he would take them off everything. If they could, if they had to be titrated off, he would do that. It was called a medication holiday.
Mhm.
And that way he was reevaluating what they actually need because people have mental health issues their whole life and they need medications. But like you said, what you're taking at 20, 40, or 80 can change the amount of medicine you need and stuff. And there are times when you just saw amazing results
Mhm.
because medications were taken away and he just
Yes.
added some that were working, but at a much lower dose. And if the behaviors or signs and symptoms of hallucinations or whatever
Right.
occurred, then he would up the dose of
Right.
whatever
Exactly.
necessary medication. But
Yeah.
it really made a difference. It
Mhm.
really did.
Yes. Yes, it does. And that's why I say even when I see people on multiple meds and no one wants to touch any mental health, behavioral health
Yeah,
type of medications. No one wants to touch it, but
yeah,
they need to be touched
yeah.
because they can be too many. They can be causing side effects. And the more we add on, believe it or not, sometimes the condition worsens because we keep adding
Exactly.
on.
I have
Um,
seen
so
that.
so
Yes.
we have to be careful of that in really considering, do we add something on? Are we reducing something else? Can we just switch and see if there's some type of assistance for the patient?
Donna, if caregivers take just one message away from this episode, what do you hope it is?
I really hope that they can feel confident in rethinking the meds that their loved ones take. If
Mhm.
you're questioning it, if you are bogged down by all of these medicines that you have to manage, there's probably too many of them.
Yeah.
So it's really important to rethink the meds, and you can learn a lot out there. And if you don't mind me saying, grab my book, grab my workbook, work
Well,
through it.
my next question for you
Yeah.
is how do we reach you? How do we find you?
Yeah. So my book and workbook are really a 5-step process to help
Okay.
caregivers, to help individuals reduce meds. And it really takes you through the process of rethinking your meds. Okay, what is this med for? Does the problem still exist? Is this helping this problem? Very
Mhm.
simple starter questions. And once you start having question marks, which people do, those are
Yeah.
the questions you start asking. So it really takes you through that. It goes through the whole like discussions to have, monitoring and follow up and having a plan, etc.
Mhm.
So it is very helpful in that regard. I can be reached on my website. It's wellhoodconsulting.com. So that's wellhoodconsulting.com. And I'm sure you can Google Donna Bartlett too, and you would see me. So that's another way to do it. But MedStrong is my book and the MedStrong workbook. In MedStrong is the little secondary title or subtitle is Shed Your Meds for a Better, Healthier You. So really trying to have people rethink that.
Donna, how do people get personal consultation with you?
Yeah. So again, you can go right on my website and there's
Wellwood.
contact information that you
Okay,
can
great.
actually go in and you can put in your information and connect with me.
I will be putting all the information on a permanent page on my site with the podcast, so people will be able to find you for a long time. That's wonderful. So
Oh,
thank you for spending time today sharing this wonderful
yes.
information because it is desperately needed.
Thank you. And thank you for the invitation. This was just lovely. So nice to meet you.
It's so nice to meet you too. Now, to my family caregivers out there, you are the most important part of the caregiving equation. Without you, it all falls apart. So please learn to be gentle with yourself. Practice self care every day because you are worth it.